Sweden is often ranked as one of the top countries in patient safety, but it's much more complicated than that.
Every organization that handles complex operations have a simple choice to make. Either the organization manages human error, or human error will manage the organization.
The bottom line of patient safety is really to look upon the situation from the patient's perspective. What would I like? How would I like to have it if it was me or if it was a close relative?
The COVID pandemic has really put a lot of stress on the Swedish healthcare system. First of all, of course, of the system, but also on the caregivers, individual nurses, doctors, assistant nurses, more or less everyone.
COVID has been the biggest crisis that we have had during my years in practice.
No one really know what this disease was going to do to us or to the patient. We didn't know how to take care of the patients.
The intensive care units had to double up or perhaps quadruple up their beds.
In the beginning, the elderly and the chronic ill patients, they didn't even want to come to the primary care setting because they were afraid of getting the virus.
And the first patients came and they were so ill, we understood that was a very hard disease.
It was new, and it was where many times I was afraid.
Many of our staff were, and myself too, were quite stressed.
But we learned a lot.
We made a lot of new routines.
So from having one or two of those patients at a time, we all of a sudden had 20 or 30.
I think it brought us together, the staff.
We learned that we could cooperate, under new circumstances, with a large amount of uncertainty.
We got something fighting spirit. We must fix this. We must work together.
I'm very proud of the medical community in Sweden, Europe and all over the world, because in this situation we stepped up and shared knowledge.
We have all learned to use those experiences in our everyday care of the patient from the pandemic on, really.
The medical community were in the lead also, and I think it's an important lessons learned that the medical community must be in the lead in the future also.
In Sweden we have a national action plan for patient safety, and the mission is to create a good and safe healthcare every day, everywhere and for everyone.
It has broaden the discussion on patient safety and deepen it as well. Before we talked about patient safety in the hospital. Now we talk about patient safety in psychiatry, in dental care as well, in all parts of the healthcare system.
We're in the midst of this revolution in patient safety management when we are moving from strategies maybe targeting more of the technical skills and the technical aspects of medicine, of a focus on individuals, towards more of a strategy for safety management that actually sort of contains all of these aspects of working with human fallibility, of working with non-technical skills, of integrating thoughts of how design of healthcare system actually creates preconditions for safety.
You need to be able not only to be good at your profession, but also to work along other professions. You need to be able to see the holistic picture of not only your work, but around the patient as well, and cooperate and contribute to the teamwork.
You say when you walk into a room you can feel the culture. And what is that? That's patient safety culture.
If you want to improve patient safety in a hospital, the hospital director has to put the topic on the agenda.
One important aspect of safety work is building bridges between the frontline staff and the managers.
From the hospital directors to get a good dialogue with the employees.
And the other thing is to keep down the level of prestige. I think prestige is one of the greatest obstacles to patient safety, really, when people can't really admit that they don't know or that they might be wrong.
You can fail as an individual, but you can also fail as a team.
Central things that I do in my role as a patient safety officer to bring the experiences of the staff to the managers, but also to make managers become aware of that they are so important in creating the preconditions for safety.
In a good working culture, everyone recognize each other and the value that they add to the team effort.
As a leader, you have to create a safe space for the staff.
If I had a rough time with my patient, I can go to a colleague to debrief or even cry or take my feelings out, and my colleague can take care of that.
So we want to change the mindset from acceptance of harm or handling harm to a more proactive way of thinking.
I can't operate without the anesthesia nurse that sedates the patient. Can't work without the nurse assistant that gives me the equipment. I can't work without the radiologist that gives me the pictures to work with. I can't work without the assistant nurse.
You need to expect from everyone to take that role also, to raise your hand and say, this is important.
We want young people to become nurses and doctors. We want them to work in healthcare with patients and to stay there.
Because if we don't have knowledge staff and not enough staff, we won't be able to give safe healthcare. And that's a really big issue.
When I first started nursing, I was terrified. It was so scary with all the responsibility for the patients, and you wanted to do everything right from the start.
As you grow in your role, you get more confidence, and you know that you can ask those questions. It's not sure that the senior knows a better answer than you do.
It's important that within a department there is an exchange of information and thoughts from younger colleagues to elderly, both ways.
You have the older generation with the knowledge and the experience, and they come and they show this new generation how it's supposed to be done and how it's always been done. And on the contrary, you have the newer generation coming in with the latest research and the latest knowledge on subjects. And the ideal is to have this sort of mutual exchange of experience. But I haven't really found that happens everywhere.
I very much like tutoring junior colleagues because I learn so much from them myself, and it's get a hang of things after a couple of days or a couple of weeks, really. And the other way around, if you are a tutor for a young doctor, for example, you learn things from him or her.
I love going to work because of my colleagues and the job as well, but especially the colleagues.
They were so helpful and explained things and let me be new, and they knew that I didn't know everything that I was supposed to know.
It's so important to create this environment with the colleagues and to have this support and network around you.
It's really important that it's like a climate at the working area where you can ask questions and don't have to feel stupid about it. And ask for help. That's really important.